Ophelia is a 3-year collaborative project across Victoria which builds a framework for healthcare sites to measure and improve the way they manage health literacy issues. There are 8 participating sites in Ophelia. Each of those is quite different. Today I'm visiting one of them, which is Bass Coast Community Health Service down at San Remo.
We see a diverse range of clients, including those with social disadvantage, and the health needs of our community are evolving. One issue is an ageing population. We expect that by the end of the decade, more than 1 in 4 of our community will be aged 65 years and older. Another key health issue is overweight and obesity, with more than 50% of the population falling into this category. Being overweight or obese has major implications on the chronic illnesses we see, especially type 2 diabetes, with the number of people in our community living with diabetes has nearly doubled. At the diabetes service here, we see about 10 clients a week. Some of these clients are likely to have higher health literacy, and for others, it would probably be quite low. Health literacy is not something we have tried to measure in the past, or we have put in specific interventions, at least until now.
So I was diagnosed with type 2 diabetes in 2011, but I already knew before that happened that I was likely to get it because my father had had type 2 diabetes at onset. So I do go out and actively seek information. I think it's my problem, my health problem, so I've got to be proactive in trying to manage it as the best I can to have the best outcome for myself as long as possible, to do all the things that I want to do in life, I guess. When I was first diagnosed, I went to a diabetes educator and they've been really good, helping keep an eye on me and helping to keep an eye on my weight. Also been to a dietitian to help me just look at recipes and things like that, because I also got a cholesterol problem, so interacting those two together has been a bit difficult. I joined Diabetes Australia as well to get their newsletters. I get a lot of information off the internet, but sometimes I find that hard to translate to what's happening in the body, so that's some of the information that I'm getting from my diabetes educator to help me with that, and I think that would be useful for people because that understanding helps you modify like your exercise regime or whatever you're doing. So that would be great if there was more information on that. I think this project might help other people by looking at things like, I use the internet a lot, but older people might not be able to use the internet. And maybe having something like peer support so they could swap recipes and things like that would be a good sort of thing to consider as part of this program.
I first was diagnosed with diabetes about 1975. I see a specialist every 3 months, which includes blood tests being done, and then in between I see a diabetes educator probably every 6 weeks. I don't have any real problems. I used to be a type 2 diabetic. I've now gone on to insulin, and I don't really have a real problem. My blood sugar levels are quite reasonable. I feel that some people may have difficulty with the diabetes, not being aware of the things they can do to help themselves in such as exercise and food, and just plain forgetful and taking needles and medicine, and it's quite important that this gets done to keep a stable blood level. This project can help by being open with other people that they have diabetics, so they know that certain things need to be done at a certain time. It would be hard for some elderly people to work to this regime.
We're just at the beginning of the Ophelia project, but I think it's already highlighting the importance of health literacy to our organisation and to our community. Thinking about what might change, we need to listen to the voices of health professionals and also our clients.
Ros and John are a very good example of people who understand how to use the health system to manage their condition. However, there are many other people who may slip through the system for many reasons. For example, family, financial reasons, cultural reasons. Language can be a huge barrier too. For example, if people relocate from one area to the other, they may fail to seek assistance. If they come from a different country, they may not understand how to use the system, how it works.
So one of the first steps for us will be using the survey tool to measure the different health literacy needs of our clients. And these are some of the surveys we've already collected.
This is great because this is a key step in the Ophelia process. Did you find it reasonably simple to collect the data?
The data collection was reasonably simple. There was a lot of work that went prior to that. There was a lot of work involved in developing checklists so that all clinicians collecting data were all on the same page and we knew what we needed to collect.
The Ophelia project is about to launch across 8 healthcare sites in Victoria. What's been really important today is to see the commitment and activity that's taking place in just one of those healthcare organisations. The success of the project is going to depend on working with healthcare professionals and on listening carefully to the voices of health consumers. It's going to be a fascinating journey.